right now on KHQ Local News.
Making sense of the measles, a virus that hasn't been seen here for 21 years, is back. What you need to know tonight and whether you're at risk.
Could the virus spread? We talked to health experts in Idaho to see what they're doing and if they're worried about an outbreak there.
Plus, would you like to get your questions answered about the measles by experts right now? You can see them here in our Connect Center. The number is 509-443-1111. We've got some information for you right now, so please call.
KHQ Local News at 5 begins right now.
Case confirmed. So what now? Tonight, that's what many of you may be asking as Spokane starts to deal with its first case of the measles in some 21 years. Ever since we told you last night at 5 o'clock that doctors have a confirmed case, many of you have called, emailed, and messaged us with your concerns about this virus. Good evening. Thanks so much for being with us. I'm Dan Kleckner.
We're glad you're here. I'm Stephanie Vigil. Tonight, we're in the Connect Center, which is just part of our team coverage on the measles virus. Straight ahead, we'll bust a few myths, ask some questions, your questions to doctors, and tell you everything you need to know about the measles.
Plus, with the confirmed case here in eastern Washington, is North Idaho at risk? That story is also straight ahead.
But we begin tonight with Gabe Cohen, who has the most essential information you should know right now. Gabe?
Well, Van and Steph, this afternoon we learned that the measles patient in this case is an employee here at this South Hill Qdoba. She is recovering this evening, still sick, but getting better. She is at home. The health district says also you can safely eat here at the restaurant. That's not actually how measles is transmitted, but this scare is certainly not over for folks here in Spokane. So we wanted you to know the 6 most important things that you need to know about the measles right now. What is the measles virus?
It's a highly contagious viral illness that usually begins with symptoms that we always call flu-like. And that can go on for 2 to 3 days before a rash develops.
Is it fatal?
Very rarely, 1 in 1,000 maybe.
How did this patient end up with the virus in Spokane?
It's, at this point, mysterious. Most cases you can find a link, but in this situation, the person had not left the county.
Should I get vaccinated today?
Some people have had 2 vaccines. They could get another. I would encourage everyone to check their vaccination status and try to make sure that they're up to date.
Is my child at risk?
If they weren't in one of the places that we identified specifically, then they shouldn't be overly concerned.
And will there be more cases?
I think there could be, yes.
Now, measles symptoms do take up to 21 days sometimes to show themselves, so the health district says right now they just don't know how many other cases may present in the coming days and weeks. We're going to have more information, though, on the specific people that they say should be on the lookout for symptoms. That's on our website, and we'll be going over it in depth next hour on KHQ Local News at 6 p.m. Reporting live on the South Hill, Gabe Cohen, KHQ Local News.
Sounds good. Thank you, Gabe. Now, starting our in-depth coverage right now. So are you at risk of infection? That's likely what many of you are asking tonight. Well, the Spokane Regional Health District says you're only at risk if you were not vaccinated and you were at one of these places at certain times on certain days. Take a look. As Gabe mentioned, the person with the measles was working at this Qdoba on South Grand that is located right next to Providence Sacred Heart on Sunday, April 12th. Now, a day later, the person was at the North Park Racquet Athletic Club near Evergreen Elementary School on Division Street much of the afternoon. Then this past Wednesday, doctors say the person with the measles was at the Franklin Park Urgent Care on North Division. That's just north of North Town Mall. The patient then was in the emergency room at Providence Holy Family Hospital Thursday night and into Friday morning of last week. That patient then went back into the emergency room this past Sunday, April 19th, from 11:30 a.m. until 7:30 p.m. Now, in case you want a second look at all those places and dates, they're available on our website at khq.com. If you were there during those times and you're not immune to measles, doctors say you may get sick between now and May 10th. So keep a close eye on how you're feeling. And if you begin to feel sick, of course, see a doctor.
We have been getting calls about the measles all day and have been leading people to experts, but there have been so many questions. We decided, well, why don't we just bring the experts in? So in our Connect Center tonight, health experts are answering your measles questions. Caitlin Reardon is in the Connect Center with more.
Well, Dan and Steph, good evening. We're here in the Connect Center tonight taking your questions about measles. Right now we're joined by Susan Joberg here in the Connect Center. She is the Epidemiology Program Manager at Spokane Regional Health. We've been taking Facebook questions today from viewers. One person, Heather, wanted to know, what do you suggest for babies who are too young to be vaccinated?
Great question. Children under the age of 12 are not recommended for the measles vaccine. They do carry their mother's immunity up until the first year if the mother's been vaccinated. At the first recommended dose of infant measles, mumps, rubella vaccine is at 12 months. So being able to keep a baby safe after that, during that first year of life, even beyond their own mother's immunity, is really paying attention, honestly, to who they're interacting with, being a little bit more cautious. I mean, we do only have one case, but we do have one case in Spokane, and so it's being cautious about your baby being held by people that you don't know, anybody that's showing any kinds of common cold-like symptoms, which are oftentimes the first symptoms for measles.
Okay, that's good advice. Well, and one person who didn't want to be identified wanted to know if this first case of measles could possibly be the reason that SPS decided to hold the vaccination clinics last week.
No. We didn't know about this case until yesterday afternoon when it was confirmed. And to get measles, somebody has to be contagious with a case of measles. That's the only way it's transmitted.
Okay. And finally, Mike wonders, and we probably already touched on this a little bit, is how can you tell if your child or a person has measles versus just the cold or the flu?
And that's the difficulty. It starts with very common cold-like symptoms, runny nose, high fever, sore throat, that we would associate during our time of the year with cold and flu. And so the telltale sign is a rash, oftentimes develops, but again, not in 100% of cases. And so the best protection is verifying that you and your children are immunized.
Okay, all right, that's good advice. Thank you, Susan. Of course, you can call the Connect Center anytime between now and 6:30 if you have questions. Of course, that number is 509-443-1111. Dan and Steph.